Hi Deborah, my name is Brandy. Thanks for coming back in. We finished your assessment the other day. We're just here to go over some more of your treatment plan and referral options. So with all this information, it says that your diagnosis is severe alcohol use disorder. You use alcohol daily, or was using alcohol daily. Do you have any other medical concerns other than your alcohol use?
I have some anxiety, depression.
Okay. Do you have any additional professionals involved in your care, like a psychiatrist or anything like that?
No, I just see my primary care doctor. I don't see them very often.
Okay. Excuse me. So with your alcohol use, there's a couple options that you can do, which is called medication-assisted treatment. That involves 3 different areas, mostly for you though, because it's just alcohol use. Is going to be the Vivitrol shot. What the Vivitrol shot is it combats alcohol and opiates. It pretty much stops them from getting any use or anything out of it. You're not going to get a high or anything off of it if you use it. The Vivitrol shot you get once a month from a nurse or a doctor, and you'll be given, I can give you the information on that if that's what you want. You just need to be careful because if you do use on Vivitrol, if you do drink alcohol, it can severely hurt you and you may need to seek medical treatment. You can get very ill off of it. What it's used for is to stop your cravings, so you're not constantly craving alcohol. The typical program involves 4 to 5 months, and they try and wean you down from there so you don't have to constantly use it. Is that something that you'd be interested in?
Yeah, I think that's the best option for me.
Okay. Well, we can get you into there. You can't get it at your primary doctor or anything like that. It has to be a specialized doctor. Only some doctors in the area can provide that. We have all the information though. We can get you set up with an appointment with them. It's actually through St. Elizabeth, so we can get you in fairly quickly with a referral process. So we're going to go over some of your assets and strengths and some of your stressors. I'm going to go down the list and I'll ask you if you are these, and you can say just yes or no. Are you supportive?
No.
Are you independent?
No.
Are you age appropriate?
Yes.
Are you motivated for treatment?
Yes.
Are you intelligent?
Yes.
Are you employed or are you going to school?
I'm employed.
Do you have any religious affiliations?
No.
Do you have good physical health?
Yes.
Are you able to benefit from treatment?
Yes.
Cooperative?
Yes.
Appropriate social skills?
Yes.
Hobbies, specials, and interests?
Yes.
Do you have any hobbies that you do?
I play volleyball
Okay. Sense of humor?
sometimes.
So we're going to go over some stressors now and areas for your growth. Have you had a loss or have had losses in your life?
Yes.
Poor coping skills?
Yes.
Legal issues?
No.
Medication non-compliance? Have you been given medication and you're not using it like how you're supposed to?
No.
Unstable family?
No.
Financial difficulties?
Yes.
Traumatic event in your life at all?
No.
Physical health problems?
No.
Substance abuse?
Yes.
That can include alcohol.
Yes. Alcohol.
Poor social skills?
No.
Occupational concerns, are you afraid that you're going to lose your job if you continue to drink?
Yes.
Do you have any educational concerns?
Not right now.
Now, can you have an inability to read and write?
No, I can read and write.
Okay. So going over these are just some areas that we can work on in the IOP program, which we're trying to get you in. The IOP program is a 6-week program. It is abstinence-based, which means that you cannot use any mood-altering drugs, including marijuana, alcohol, opiates, anything like that. Are you willing to be abstinent for at least 6 weeks?
Yes.
Especially with the Vivitrol shot, if you do decide to do that, it's very important to stay abstinent with that as well. So with the this information, we're going to give you some referrals, what we recommend that you do, okay? Of course, we're going to recommend you to the IOP program. We're going to get you in as soon as we can. Most likely on Monday will be our opening for one of our groups. The group that you'll be attending will be a substance use group. It's in the morning from 9 a.m. until noon. You get a break in between. And then after that, after you completed the IOP program, we have what is called an aftercare program. They meet once a week, every week, and it's just an ongoing thing. You don't have to pay for it. It's just a check-in process. Just something that we give to our clients after they completed the program. That meets also on Mondays and Tuesdays. Mondays is later in the night. Tuesdays is in the morning. We're going to recommend you go to that after you complete. We also recommend a 12-step recovery program, which is like an AA or an NA. Do you know what Alcoholics Anonymous is?
Yes.
Okay, we recommend that you go there, start getting your foot in the door with that. When you start getting more familiar with the AA groups, we're going to ask you that you get a sponsor. What a sponsor does, it helps you work. They are somebody with years of sobriety, and they help you work through the 12 steps and gives you a sober support system. And also with that, we're going to ask you that for consistency, you find a home group, which is a group or a meeting that you go to every day of the week. Like say you have a special meeting that you like to go to on Fridays at noon. That would be like your home group. If you really like it, you can make that your home group. Okay. Speaking of support systems, who are your support systems?
My parents, my husband, and 2 children.
Okay. With the IOP program, we also help you develop coping skills, and you deal with your cravings and triggers as well. I forgot to tell you that earlier. But along with the 12-step recovery program and the IOP and the aftercare, we're going to recommend you to get an individual therapist. This helps after the whole program is over, so you have a continuing of care instead of it's not just you or you and AA. You have somebody else that you can contact and help you through tough issues that you're going through in life. We may or may not refer you to a family or couples therapy, just so your family has a more education on your alcoholism and what you have to do and what they need to do, and codependency issues if there is any. We can get more into that once you're in group and stuff with your therapist. Let's see. Actually, part of our contract that you signed the other day, you will need to obtain a therapist or sponsor, like we talked about, by the 3rd week of treatment. We're kind of lenient on that. We just want you to do it, but definitely before you leave treatment. It's just something that helps, you with your recovery. We also have I've been working on a great referral list for the IOP program. It has a whole list of individual therapists that we recommend for certain issues. It also has psychiatrists, which I also recommend. That's another referral. You to start getting a psychiatrist or a psychologist with your anxiety and depression, so you can get medicated and get that balanced if you do want to do so. That thing I was talking about also has support groups on it and community resources as well to help you through your recovery process. And that's something we give to all of our clients just so they have something to go along with. With all that said, do you intend to, start the IOP program on Monday? And you're gonna, you're not gonna miss any. And if you do, you're gonna contact your therapist and talk to them and see why you missed. And okay.
Okay.
Well, thank you for coming back in, and we'll see you on Monday. Okay.
Thank you.
All right. Have a good day.